Hello, I'm Jackie Salter. I'm an osteopath working in Brierley Hill in the Black Country. When you come to see me for the first time, you'll be allocated an hour, and you're welcome to bring along a friend or relative to accompany you during the consultation. Initially, I will ask your permission for me to take your case history and examine you. When I take your case history, I'll be asking you about the problem that you've come to see me about. So for example, where does it hurt, what makes it better or worse, how long you've had it, and if you know, what caused it. I also need to do a medical history to make sure it's safe to treat you. As part of that, I'll be asking about medication. So if you do take any regular medication, please bring along a note of that. Once the case history is complete, I'll then move on and examine you. Now I usually examine my patients in their underwear, and there's a screen here for you to change behind. But if you don't want to go down to your underwear, that's fine. Just let me know and bring along some shorts or some thick tights or leggings for you to change into. Once you've changed, I will examine your posture and ask you to perform a series of simple movements for me to assess your problem. I will then ask you to lie on the couch and cover you with a towel. And using my hands, I will examine the joints for any restrictions in movements or stiffness. I'll then examine your muscles for any tightness or pain in those muscles. Now, it may be necessary for me to perform some additional tests depending on your problem, like I may need to test your reflexes. But once the examination is complete, I'll then explain to you what I've found and what I think is happening with the help of George here and possibly some diagrams. I'll then go through your treatment options. Now it may well be that it's not safe or appropriate for me to treat you, and in that case I usually send people back to their own doctor. But if it is safe for me to treat you, I'll explain the particular treatment that I want to do for you and ask your permission for me to carry out that specific treatment for your problem. Once the treatment's over, I'll then give you some advice for things to do at home, for example exercises that may help, and advice on returning to work or sport. You can refuse any part of the examination or treatment at any time, even if you've previously given me permission to perform that. If there's anything that you don't understand or that you're unsure of, please ask me questions at any time, because it's important that you understand what's happening. Thank you.